Hi everybody, thanks so much for joining us. We are broadcasting live today from the region's only level 4 newborn intensive care unit. So this is where the very sickest and smallest, most vulnerable babies come for the very best in medical care. And we are going to get to meet some cute babies today, which is exciting. Tour a room and learn more about this service. So our guide today is Dr. Nicole Birge. Thanks for being here.
My pleasure. Thanks for having me.
And she's going to take our questions. So if you have any questions, comments about anything you see in the video, any of the care we provide here, please just put those in the space below. So my first question is, we know there are several NICUs, newborn intensive care units, in Omaha, but we're the only level 4. So what does that mean for people?
So level 4 means that we can take care of the smallest and most premature infants with a variety of devices and support that they would need, but we also have immediate on-site access to surgical specialists, medical specialists, anesthesiologists, and the most up-to-date technological advancements that we can provide. It also means that we offer transport services to get babies to the hospital, and that we provide outreach to other hospitals within the community.
Okay, I'm glad you mentioned transport because Children's does not have a traditional labor and delivery unit for moms. So how do babies come to Children's NICU?
So the vast majority of our patients are transported in by our transport team. Last year we did about 340 transports. So those babies were brought to us either by ambulance, helicopter, or airplane after their physicians, wherever they were, decided that they needed to come to a higher level of care.
Right, okay. So, fun part. We're going to head into a room, and maybe you can introduce us. I know we have to Purell, right, before we go in. So we've got some options. I'm going to get this little guy. And we are going into the room of a pair of twins. So,
Here they are.
Here they are. Yep. Adorable little boys.
So these are Knox and Brooks, who are twins. They were born early at 26 weeks gestation, which is about 14 weeks early after mom went into preterm labor. Brooks was the first to join us because he needed consultation with some of our surgical specialists, and so he came to get that service provided, and then a few days later Knox joined him. It was very important for us to keep both babies together because in addition to the stress of having premature twins, we didn't want to add the additional stress of having 2 babies in 2 different hospitals. So that was something that was very important to us, to get them here together so that the family could have one place where both babies were.
So do they kind of have the same challenges, medical challenges right now? Or?
Initially they did, but as time has progressed, their issues are a little bit different now. Brooks had difficulty with feeding, and that is getting better. He used to have a tube in his nose that would provide him with his milk, and that was just removed this week.
Yay. And
he was also needing oxygen to help with breathing. That was also taken off this week. So he's made a lot of advancements in the last couple weeks and getting a little bit closer to going home.
Wow. Hey Brooks, you're on camera for the world to see. Oh, and he's stretching. He's like, I'm so over it. All right, well let's go meet Knox too, and you can tell us a little about him.
So this is Knox. He still has some ongoing issues, particularly with feeding and breathing. So you can see he has 2 little tubes that are in his nose. This is providing help from a ventilator and a little bit of oxygen to assist him with breathing. His lungs, because he was premature, were a little bit undeveloped, so he's needing a little bit of assistance with that. And then because his lungs are still recovering and he's breathing very quickly, the way that he eats is through this little tube that goes from his mouth and then directly into his stomach, and so we drip the milk in that way.
Okay, so you mentioned the ventilator and then the feeding tube. What is this up here, this monitor?
These are physiologic monitors which keep a continuous measurement of heart rate, oxygen saturations, breathing rate, and in some babies a continuous monitoring of their blood pressure. Each baby in the NICU has one, and then they are located centrally outside of the room so that even if we're not within the baby's room, we can see what's going on at all times.
Okay. And I want to draw attention to this little guy back here. There's so much equipment, but I know their mom said she loved this thing. So explain what this is.
Yes, this is a NICView camera. This allows parents, family members, and friends to have a look at what's going on with the babies when they can't physically be present. So this is connected to a website, and we give families a password where they can log in and see what's going on with their baby any time of the day.
So that really helps them stay connected because How long is a typical newborn intensive care unit stay?
It depends a little bit on how big you are when you're born. We tend to separate it out based on whether you're less than 3 pounds at birth or you're greater than 3 pounds at birth. So the babies who are born weighing less than 3 pounds, their typical stay is about 2 months. For babies who are bigger than that, it's shorter. It's about 18 days. But we do have babies who stay here for up to a year, and we have had some 1-year birthday parties in the unit as well.
So you take these intense medical situations, and then this is just an intense time for a mom, for a dad. Just talk a little bit about the relationships that are built in this unit.
We meet families at probably is one of the most stressful times in their entire lives.
Right.
Some families know that their babies are going to need a higher level of care after they're born, and so they may be prepared for their trip to our NICU, but for other families it comes as a complete surprise. And so our goal really is to guide them through that process. There's a lot of stress and anxiety, and we want to try to minimize that as much as possible. And it's just really fun going through the transition of having a little teeny tiny baby who is in an incubator and then grows up to be 8 pounds and is working on feeding, and their breathing issues are getting better. It's just a really fun thing to experience with these families.
And then, of course, I know one of the favorite events that we have each year is the NICU reunion.
It is.
Which kind of, even as they grow older and into their being a toddler and kindergarten, how special is that event for you?
It's wonderful, actually. I am always amazed at how much they transition and change during their time with us, but after they leave, the change is even more dramatic. And so we have the reunion on a yearly basis, and so some of these babies we may not have seen for a whole year. So when we go to the reunion, we don't even recognize the babies anymore because they've changed so much. So we have to look and find the parents, because the parents look pretty similar, but the babies are totally different.
Oh my goodness. So I know everything we do here at Children's is really a team, and that's very true in the newborn intensive care unit. Talk about the team approach and all the services that make up care here.
So every baby has a nurse who does a lot of hands-on care. There is also a nurse practitioner and a physician assigned to every baby to oversee the care that's provided. For babies like Knox who need oxygen or support for breathing, there's a respiratory therapist. We also have physical therapists and occupational therapists who help make sure that they have good range of motion and that they're getting movement and exercises that they need, especially for those who are here for longer periods of time. We have speech therapists. We have a developmental care specialists. We have lactation consultants, and they help moms with not only pumping milk when the babies are first here, but then also with breastfeeding once the babies are ready for that. So it's a really big team effort that plays into this.
Yeah, and especially when you mentioned lactation, I thought, in this environment, you've just had a baby, maybe you can't hold them, maybe you've been thrown a curveball, you didn't expect something medically. How do you try to involve parents when they might feel really out of control in their present reality in the care?
Yeah, so one thing that we have done over the last couple of years is get parents much more involved in the rounding process, where we review the data from the last 24 hours and we make decisions about what we're going to do for the next couple of days. This used to be done really in isolation from the family, but we have really changed our philosophy and changed that process, and we are trying to make this more family-centered. So now we invite and encourage parents to come back to rounds with us. They see all the information that we see, and we come up with a plan together. And it actually is really helpful for us as providers too, because a lot of times moms who are here a lot, like Clarissa, have a lot of insight as to what's going on with their babies, and so we rely a lot on their input when we're making our plans for the day.
And another thing that involves parents is kangaroo care. What, kangaroo care? What is that? How does that work, and why is it important?
So kangaroo care is just a way for parents to bond with their babies, and we hold them what we call skin to skin. So the babies are just in a diaper, and usually the parents have an exposed chest, and we really get the baby snuggled up with either mom or dad. We actually have special shirts that we give them to kind of hold the babies in position, but this allows us an opportunity for the parents to bond with their baby, and has a lot of benefits for the babies as well in terms of stabilization of their heart rate, of their breathing pattern, and of their blood pressure. They gain weight better, and they tend to leave the hospital sooner if they've had lots of exposure to kangaroo care.
That's incredible.
That's something we try to promote every day and have a daily discussion about. Have you held your baby? Have you done kangaroo care today?
And then there's the role of volunteers. I think one type of volunteering that's gotten a little attention lately, I think in the media, social media, is our NICU cuddlers. let's talk about those cuddlers.
So
They're
these
very
are
special people.
amazing volunteers who come through every day of the week and are looking to kind of fill that role of someone who can cuddle or snuggle with a baby when a parent can't be here. And they have books, they check out books, they read to babies, and they provide that interaction that some of our babies are missing. 6 out of every 10 babies in our unit are not from Omaha, so they're from outside the city. Their parents can't be here every day, so we really rely on our cuddlers to kind of fill that role in terms of providing that human touch and one-on-one attention that these babies need.
Okay, I have to draw people's attention to this beautiful scene. Mom Clarissa said that it was okay if we got her a little on camera, but look at this guy. He's pretty happy being cuddled by his mama. I think, yes. Brooks is a happy boy right now. And I love as you look like through your window and all these things, that little sign, you can just see that these babies are pretty loved up here in this NICU.
They are, and when we look at some of even the things that we have in Brooks and Knox's room, every milestone here gets celebrated. So every time they turned another week older, we celebrated it. When they hit the 5-pound mark, the 6-pound mark, we celebrate those things. 2 days ago was their due date, and so we celebrated that as well. So these tiny little baby steps really are big milestones for us that we like to celebrate every day.
We've talked kind of about the touchy-feely, warm side, but of course there's so much science in everything you do too. Some people might not have heard of a neuro NICU, which is something we do here. What is a neuro NICU?
So it's a collaboration between specialists from all different parts of the hospital where we're really focused on giving advanced care to infants who have either had brain injury or are at risk for having brain injury. So these are babies who may have had a stroke, who've had seizures, who have spina bifida, and so we get this team together of experts where their focus really is on brain care and promoting the best medical attention and things that we can give to these babies.
So the newborn intensive care unit will be a really key part of the Hubbard Center for Children,
Yes.
which everyone has seen the construction along Dodge, and it's coming along great. What will the newborn intensive care unit look like in 2021 over at the Hubbard Center?
Well, first of all, it's going to be bigger. We currently have space for 41 babies, and with a new tower, we'll be able to accommodate 52 babies. The thing that matters a lot to us too is the proximity to the rest of the hospital. So there's a skywalk that connects us physically with the other half of the hospital. We're going to be a lot closer to the operating rooms, and a lot of our babies undergo surgery. We're going to be closer to the MRI and CAT scan and other services that our babies need, where a simple procedure like surgery or a radiology procedure, they have to make a big trip across the street. And sometimes a trip across the street takes longer than the actual procedure itself. So we are really looking forward to having closer proximity to the services our babies need.
It's going to be huge. So very exciting, and it's one of those things, it feels like a long time away, but it'll be here soon.
Before we know it.
Absolutely. So let's get a little personal with you, Dr. Birge. She's like, what is she going to ask me? Why did you choose neonatology?
When I first chose this, I was really into all the excitement that occurs when a baby is born. A lot of babies that are born prematurely need help in the delivery room, and so you're doing resuscitations, you're maybe putting in breathing tubes or giving them medicine, and I really, really like that part. Now that I've been doing it for a while, I realize that I really like taking this little tiny human who is really, really sick and watching them move through those stages of developing and getting closer to their due date and all of the changes that they go through. I just love it. And so that's one of the reasons why I chose it. And the connections that you make with families too has also been really important to me.
So that's what makes it so rewarding.
Absolutely.
Yeah, wonderful. Well, thank you so much for your time and your expertise. And also a big shout out to Mom and Dad of Brooks and Knox they get their little 15 minutes of fame. You're precious, precious boys, and we just wish you all of the best. It sounds like this kid might get to go home soon, so that's pretty exciting. So thank you everyone so much for joining us and supporting us here at Children's Hospital and Medical Center. You can follow us, of course, on Facebook. But we also have a new Instagram account at Children's Omaha, Twitter, and of course you can always visit us online at children'somaha.org.